Hey everyone, welcome to Farm Journal Live. I'm Clinton Griffiths from the Farm Journal Newsroom, where we'll be bringing you updates around the coronavirus outbreak and its potential impacts on the agricultural industry for the foreseeable future as we continue to deal with this as a national issue across the country. Let's begin with some news right now. Leaders in Washington are negotiating and continue to work on a stimulus package, a near $2 trillion rescue package. They say it is on the way. They're hoping to reach some sort of deal soon. U.S. stock futures rising on Tuesday on hopes that the deal will happen. Now, as far as deaths go right now, we've nearing that 600-person mark, and of course the 2020 Olympics have been canceled. We're also hearing from several other sectors of the ag industry facing economic challenges from this virus, including the ethanol industry. One of the nation's largest ethanol producers, Poet, saying it is stopping buying corn at some of its facilities. Poet says experts are projecting a 957 million gallon drop in ethanol demand from this month through May, adding up to about 331 million bushel loss in corn demand. Now, on the dairy side of things, more buys at the grocery store likely won't be enough to offset those losses as that world economy slows. The National Milk Producers Federation forecasting losses over the last 5 weeks at somewhere around $2.85 billion. NMPF now asking USDA to reopen sign-up for the Dairy Margin Coverage Program. And cattle producers also asking for some help. NCBA says it's working with folks in Washington. Let's go ahead and bring in Drover's editor Greg Henderson now. And Greg, as we talk about this, there are some big processors announcing that they're going to be tacking some money onto cattle markets, even as we see our markets today moving mostly limit up in a lot of cases.
Yeah, that's right, Clinton. Tyson announced over the weekend that it would add $5 per hundredweight to fed cattle that it buys this week, and roughly that's 150,000 cattle that they buy and process each week. Also, National Beef announced that they would pay $113 per hundredweight for all of the cattle they bought last week. Now, that's probably a bookkeeping nightmare, because on Monday those cattle were purchased at 105, and then by Tuesday it was 110. Then Thursday it was 113, but they're going to make it 113 for everything. So not all of the processors are participating. Some of them have decided to cut the price of the beef going out the back door to their retailers to help those retailers fill those empty shelves that I'm sure everyone has seen by now. The difference is that some ground beef is priced at $7.50 in locations, a similar product priced at $4.50 a pound. So a big difference there, and a difference in the way these processors are handling this problem.
Do you think, I think that's one of the questions that a lot in the ag industry are asking. Is this enough, Greg, given some of the, the feelings that folks were having about the hard drop in cattle prices we saw last week versus those retail boxes? Does this help make up for any of that, or do we have a ways to go on this situation?
It does help make up for it some, but as we remember, this is the second black swan event the cattle industry has faced in the last 6 months. I'm referring to the Tyson packing plant fire last August. Certainly the same thing happened with the coronavirus that happened back then. The problem with the coronavirus is we don't see an end in sight, and it was one packing plant when the fire happened that basically they were able to overcome the supply disruptions for a while. And now we don't really know what's going to happen. So product last week was shifted from food service to retail. That helped fill that void. And now there's a huge demand, and we've seen the choice box beef price skyrocket higher. It was $257 yesterday. Who knows where it's going to go the rest of this week. But, the problem is that the futures now is having trouble catching up to the cash price. A lot of producers that were hedged sellers are making out well. Right. Not everybody is hedged, and those cash prices are definitely hurt. There's a lot of animosity towards the packing industry throughout cattlemen everywhere, and a lot of it stems from what happened to them last fall.
Sure.
So where we go from here, demand after we get these meat cases filled back up again, and my guess is that demand's going to suffer a little bit, because if people already have freezers full there's not going to be as much demand for that retail product. However, if we get those restaurants open again in the next 2 or 3 weeks, maybe that's going to soften the blow.
Greg, one of the things we've been talking about is what's happening in Washington, some stimulus money that's out there. There's been some talk about maybe another MFP type of payment, and this time including livestock producers. Cattlemen expect to be in on that this time?
They sure hope to be in on that, and I think well deserved. They've taken a brunt of a lot of this, and the feeder cattle prices dropped dramatically quickly. People who typically sell holdover feeders and sell this time of year, got caught into this. And there was not a lot of margin in those cattle to begin with because of where we're at in the cattle cycles. So, definitely this is a tough time. And as you know, the weather that we had last year didn't help matters any. So they would like to participate as well.
All right, appreciate that, Greg. Greg Henderson with Drovers there. Greg, thanks so much for giving us some insights into what's happening on the cattle market and in the beef market. Let's bring in now Alan Morgan, CEO of the National Rural Health Association. And Alan, you've been tracking this very closely, what's going on in our rural communities, type of issues that we're facing out there. Can you set the stage for us? How are things going right now in rural America and our hospitals out there serving on the front lines?
Absolutely. Thanks for allowing me the opportunity to join with you today. Well, across the United States, our rural hospitals are prepared for this. Over the last 72 hours, we've started to see cases pop up in rural communities in Kansas, North Dakota, obviously Washington State. So rural is not immune to this. The real question is, are we going to have the capacity for any surge in that component? Are we going to be able to keep our healthcare workers in a rural setting safe and access to protective equipment? And can we just keep the doors open for a lot of these rural hospitals that are struggling financially right now?
And I think that is the question that a lot of folks are asking. How do we look so far? And I know the big question is kind of that, do we have enough beds and enough equipment and enough people to help make sure that we stay healthy in these rural areas?
Oh, absolutely. Thank you for that question. More than half of the nation's rural hospitals, on average, have one ventilator at their facility. So that's really important to know. I know from a rural perspective, we expect this to be most severe in urban areas, but we just have to know we have limited staff there at our hospitals. Please don't show up unannounced. Please call in advance. And the real question is, once some of our healthcare professionals in a rural setting become COVID-19 positive, how do they fill the gap from a rural component on that? So some real questions on that.
Those are big questions. I know as we were talking with Greg before, Washington's working on some policies, some stimulus type stuff. What would you like to see from a rural health perspective included in any of that legislation?
Oh, absolutely. This is a fast-moving target right now. We're seeking direct cash payments to these rural facilities. The problem is more than half of them were losing money before this, and now they've cleared out their beds in anticipation for these cases. So a lot of these rural hospitals are facing a significant cash crunch right now. We need to get the money out there so they can keep their doors open, number one. And then what Congress is looking at in this package right now is a fund to be able to distribute across the United States. And in addition to that, some long-term payment increases just to make sure over the course of this next year, you will always have an emergency room available there in your community when you need it.
Yeah, those are a big need, especially as we move forward. Do we have we learned it? And I think I asked you this on AgriTalk about a week ago. Have we learned anything yet? It's been about a week as we start to get more of these cases popping up here in the U.S. And how far out should we be thinking? Or we need to be planning days, weeks, months ahead here?
Well, from a rural perspective, at least the immediate future is a real danger. And as we talked last week, I think there was concern about access to personal protective equipment, the mask. Unfortunately, now I'm hearing more and more cases of rural hospitals that are reusing their mask right now. So it's gone from a concern to what they're actually seeing at that point. It just goes without saying, you've got a higher percentage of elderly in a rural context. When we talk about chronic health needs, that is rural America. So those people that are most at risk for this virus are all situated in a rural community. I can't stress it enough. I know that you're hearing all the news about New York and the big cities. Please take this seriously in a rural context. We just don't have the room for mistakes that they have in a large facility where they've got a ton of staff to throw at this.
All right. Well, we appreciate the conversation. Thank you so much, Alan, and appreciate the work you're doing to help keep our communities safe. You heard his words of encouragement there to make sure that you're taking this serious, that you're being safe at home, doing your part as far as social distancing goes. We'll continue to follow this outbreak and provide as much information as we possibly can. You can follow us each and every day here on Facebook Live during the week as we try to bring you the